Anxiety in Black Americans: causes, stigmas, and how to cope. Anxiety is a widespread mental health issue, yet many Black people avoid treatment due to stigma. Clinicians may also fail to recognize the impact of racial trauma on Black individuals seeking help. Following George Floyd's death, the Census Bureau reported increased anxiety and depression among Black Americans. Anxiety and PTSD often present differently in Black people compared to white Americans. Anxiety can be triggered by early trauma, family history, and certain medical conditions. Black Americans face additional risk factors, such as racial trauma from exposure to racism, fewer opportunities, and less safe communities. Anxiety manifests in various ways, including OCD, PTSD, phobias, and generalized anxiety disorder. Common symptoms include physical tension, feeling anxious or irritable, and experiencing nightmares or flashbacks. Over time, anxiety can severely impact health. Researchers argue that Black Americans experience weathering, a long-term erosion of health due to chronic trauma, stress, and racism. This contributes to shorter lifespans. Mental health issues are more prevalent among Black Americans, who have a 20% higher rate of serious mental health problems than the general population. PTSD is particularly common, largely due to high rates of racial trauma. Alarmingly, suicide rates are rising rapidly in the Black community, especially among children. For instance, 9.8% of Black high schoolers report attempting suicide, compared to 6.1% of their white peers. Myths about Black mental health perpetuate stigma. One common myth is that anxiety is a personal problem that can be overcome with the right attitude. But mental health conditions require more than just positive thinking. Racist scientific claims have suggested innate psychological differences between races. In reality, race is a cultural construct, and such beliefs ignore the role of racism and discrimination in mental health. Another damaging myth is that Black children don't experience mental health problems. However, the rising suicide rates among Black children contradict this belief and highlight the need for mental health care. Stigma in Black communities often discourages seeking care. The cultural expectation to be resilient can make admitting to mental health struggles feel like a weakness. Racism can exacerbate mental health stigma, as some Black people fear being labeled as crazy or dangerous if they seek help. This further complicates their mental health journey. White therapists may unintentionally uphold racist norms or fail to address racial trauma, making therapy less effective for Black clients. This issue underscores the importance of culturally competent care. For many Black people, mental health support is less accessible. Stigma, fears of racism in therapy, and the scarcity of culturally competent therapists are significant barriers, especially in predominantly white areas. Financial barriers also exist. In 2018, 11.5% of Black people were uninsured, making it difficult to afford therapy. Even with insurance, finding a quality therapist who accepts coverage can be challenging. Effective anxiety treatment requires a personalized and collaborative approach. Finding the right technique involves trust and openness to various interventions with a mental health provider. Therapy is a primary treatment for anxiety, helping individuals understand their triggers, develop coping skills, and find emotional outlets. Cognitive behavioral therapy is especially useful for managing thoughts and emotions. Medication can also be effective. Options include anti-anxiety drugs, antidepressants, and sleeping aids to help manage symptoms alongside therapy. In severe cases, residential treatment might be necessary for individuals with life-threatening anxiety or other mental health issues. This provides intensive support and care. Self-care practices like regular exercise, quality sleep, and a balanced diet can aid in reducing anxiety and maintaining overall health. These habits are fundamental components of mental wellness. Activism can offer a constructive outlet for those affected by racial trauma. Engaging in social change can provide a sense of purpose and community, helping to alleviate some anxiety symptoms. Supportive communities are crucial. Connecting with people who understand the intersection of race and anxiety can offer valuable emotional support and validation. Alternative remedies like meditation, acupuncture, and yoga can complement traditional treatments. These practices can help calm an anxious mind and promote overall well-being. Anxiety can be debilitating and hard to manage, especially with the additional burden of racial trauma. For Black Americans, these intersecting issues make it crucial to seek appropriate support. Breaking the stigma and addressing access issues are essential steps toward better mental health for Black Americans. Overcoming these barriers can lead to meaningful improvement in anxiety management. Physical symptoms of anxiety can be particularly distressing, causing significant fear and discomfort. This emphasizes the importance of seeking proper treatment to improve quality of life. Finding a therapist who understands the unique experiences of Black Americans is vital. Culturally competent care can make a significant difference in treatment outcomes. Treatment can be a lengthy process, so building a trusting relationship with a therapist is key. Patience and perseverance in finding the right support are crucial for effective mental health care. Mental health advocacy and education can help dismantle stigma and promote better understanding of anxiety in Black communities. Awareness is the first step toward change. Encouraging open conversations about mental health within families and communities can create a more supportive environment. This can help individuals feel less isolated in their struggles. Healthcare providers need training on cultural competence to better serve Black patients. Understanding the role of racial trauma can enhance the effectiveness of mental health interventions. Policy changes to improve access to mental health care are necessary. This includes better insurance coverage and increased availability of culturally competent therapists. Empowering Black individuals to seek help and providing them with the right resources can lead to better mental health outcomes. Everyone deserves access to effective mental health care. In addressing anxiety in Black Americans, it's crucial to consider the unique factors at play. By recognizing and addressing these issues, we can work toward a more equitable mental health care system. Mental health is an essential part of overall well-being. Supporting Black Americans in managing anxiety involves community effort, systemic change, and personalized care. Understanding and tackling the causes and stigmas of anxiety can pave the way for more effective coping strategies. This collective effort can significantly impact the mental health of Black Americans. Together, we can break down barriers and create a more inclusive, supportive environment for everyone dealing with mental health issues. Let's continue to educate, advocate, and support each other on this journey.